Are you recording out there?
We are.
Okay, it is
Our
7
meeting.
p.m. The meeting will now come to order. In accordance with the requirements of the open meeting law, we will use the guidance list that the state has provided us to read, and our Vice Chairman Perry Jewell will so read. Perry?
Thank you, Mr. Chairman. Yeah, as a preliminary matter, and as you requested, this is Perry Jewell, the Vice Chairman of the Board of Health. I'll do a roll call to confirm that all members and persons that we anticipate on the agenda are present and can hear me. So beginning with the members, when I call your name, please respond in the affirmative. George Eamon.
Aye, here.
And our new member, Lisa Normandin.
Here.
And we're missing two members, Evan Waters and Paul Forten. They often join slightly late, so I'll note when they join us if they do. Turning to the staff, our administrative assistant, Andrea Schnepp.
Here,
Andrea, can you hear
I'm
me?
here. Yep, I can.
And George Gareffi, our agent. Jim Gareffi, our agent. Can you hear me, Jim?
I can hear you.
Okay. And regarding anticipated speakers, I can see that Doug Smith is with us and we anticipate him as our first speaker. Doug, can you hear me? Oh, you need to unmute there.
There you go.
Yes, I can hear you.
Okay, thank you, Doug. Okay, in accordance with the requirements of the open meeting law, please be advised that this meeting is being recorded and broadcast over the Lunenburg Public Access Channel. And this meeting of the Lunenburg Board of Health is being conducted remotely. The town of Lunenburg, in response to the COVID-19 coronavirus, is currently following the guidance of the Lunenburg Board of Health, Massachusetts Department of Public Health, and the CDC regarding the virus and steps communities can take to prevent the spread. And all town facilities which have currently been closed and then were opened by appointment are now open in general to the public, so long as the public does wear their mask indoors and in the town buildings and practice appropriate distancing. But in accordance with the governor's order suspending certain provisions of the open meeting law, general law, chapter 30A, paragraph 20, all public meetings are being conducted remotely. The order, which you can find posted on the town website on the COVID-19 information page accessed through the town manager's webpage, allows public bodies to meet entirely remotely so long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. Ensuring public access does not ensure public participation unless such participation is required by law. This meeting will allow public comment at the very end, limited to a few minutes per speaker. For this meeting, the Lunenburg Board of Health is convening via Zoom as posted on the town's website, identifying how the public may join. Please note that this meeting is being recorded and that most attendees are participating by video conference. Accordingly, please be aware that other folks may be able to see you, and take care in screen sharing your computer. Anything you broadcast will be captured by the recording. We're now going to turn to our first item on the agenda, but before we do so, permit me to cover some ground rules for effective and clear conduct of our business and to ensure accurate meeting minutes. The chair will introduce each speaker on the agenda, and after they conclude their remarks, the chair will invite members to provide any comment, questions, or motions. Please remember to mute your phone or computer when you're not speaking. It does help to eliminate feedback. And please remember to speak clearly and in a way that helps to generate accurate minutes. For any response, please wait for the chair to yield the floor to you and state your name before speaking. If members wish to address other members, please do so through the chair, taking care to identify yourself. And finally, each vote taken in this meeting will be conducted by roll call vote. So Mr. Chairman, with that, the meeting is all yours.
Okay, you stole all my thunder there. The only thing I was going to add, you already did, is that any and all votes taken voice vote, and we will identify each of ourselves as we do vote. Yeah,
One more item, I guess, Mr. Chairman, is that Evan Waters and Paul Forten are both joining us at this
okay,
time.
so we have them all.
So we have our other
Welcome.
two members. Evan is currently, serving on our board, and similarly, Paul Forten has served as our scribe and is.
Harry, I'm
has
having a
been
little trouble.
reelected.
I'm having a little trouble hearing you. I don't know about the others. You might want to turn your volume up a little bit or speak a little louder.
Okay, I'm basically done. It's all yours.
Okay, we can get right to our agenda. We have a very slight agenda this evening. Our first item is request for a variance for 249 Pleasant Street. I see that Doug Smith is here. Doug is the engineer for it. Doug, would you like to address this? Wait a minute, I'm looking for my letter, Doug. I got it right here. Let me read your letter first, and then we can get into it. This is to the Board of Health. I am requesting to be on the agenda for the next available Board of Health meeting for a local upgrade variance request for 249 Pleasant Street. Tax map 94 lot 33 for Brenda Burpee and Diane Cody, care of Bob Proctor Excavation. The local upgrade variances are 310 CMR 15405 1H, requesting a local upgrade approval to allow a reduction in the 4-foot requirement of separation between the bed bottom of the soil absorption system and the high groundwater. Requesting a 24-inch reduction, which will result in the soil absorption being 24 inches above groundwater, with a 0.33 result in the soil absorption system. Oops, I'm sorry. With a 0.33 loading factor. And also 310 CMR 15405 1J, reduction in the 12-inch separation for the tank inlet and outlet tees and high groundwater. Provided is a tank inlet is 2 inches. Tank outlet is 0.5 inches. Well, pump inlet and pump outlet. Local upgrade variance for alternative to perk testing, 310 CMR 15104, 310 CMR 15405, 1I. Lab test of soil was performed instead of conducting a perk test due to high groundwater in the most restrictive soil layer. Thank you for your consideration, Douglas Smith, SE. Okay, Doug.
Okay,
Doug?
this is a very small lot, 0.29 acres.
Yeah.
And the system and the fill around it takes up pretty much the whole backyard. So that's why I was asking for that first upgrade variance for the 24-inch reduction, just to get everything to fit. It was brought to my attention today on the tank and the pump to do with the second variance. I believe some of my math that I had put on that letter isn't quite right. I think the tank is actually has less separation. And Bob Proctor is going to go to the house tomorrow, go into the basement and see if the pipe for the sewer can be raised up. We're hoping we can raise it maybe 8 inches or a foot. And if that can happen, it will help with that variance number 2 that we talked about with the tank inlet, tank outlet, and all that.
Is that 15405J?
Correct, yes.
Yeah.
And if something happens and if he finds out he can't raise the pipe, then what we're gonna change and have monolithic tanks go in for the pump chamber and tank, and the kind that has the boots. So that will help. But that is something that was brought to my attention. I want to make that right.
Okay. Jim, can we have some input here?
Sure. So as Doug mentioned, it's a tight little lot there. Unfortunately, Pleasant Street has high water table, has slow perk rates. Fortunately, this slopes away from the house a little bit, so hopefully it'll be able to grade out to the backyard. And the backyard goes into the field, which is nice, the solar farm. So it's not like the grading will affect anybody back there. It's to the solar farm. Because of the high water table, because sometimes you're stuck with an existing building sewer coming out of the house. That's what Doug was talking about. The tank outlets may be too close to the water table for the numbers that he mentioned. I talked to Bob Proctor earlier today and asked him if those things, it looks like if you look at Doug's elevations, maybe there's some room there, but I never know if basements are finished or pipes are obscured somehow in the basement. So Bob was going to go check and make sure. As Doug mentioned, monolithic tanks, particularly for the pump chamber, are important. Septic tank, if it's full, typically won't leak in or out in those situations, but a pump chamber is almost always empty. And so if there's a seam halfway and it leaks, or if it's in high water in a high water table and it leaks, that runs the risk of prematurely failing the system. So the monolithic tank's a good idea anyway, particularly for the pump chamber. The tanks typically have rubber boots that are cast in the tanks so that they put the pipes through, they can actually clamp the pipe with the rubber boot around it so they can get a good seal. Otherwise, what they do is try to hydraulic cement the tanks. The nice thing about the rubber boots, they're a little more flexible. So when you're backfilling and things settle a little bit, they probably still provide a tight connection between the tank and the piping to try to minimize groundwater getting in the tank. So I don't see an issue with the request Doug has. And if we can't, if they can't raise the plumbing, we'll just have to, try to adjust the tanks in such a way that we can maximize the offset between the outlets of the tank and the groundwater.
Yeah, that pump outlet is 1 inch. What's that going to change to if in the best outlook? Is that going to remain an inch? The
I'm
pump out-
hoping there could be more than that, but I really don't know until they check the basement. And I guess my original thought was it was an 18-inch water table everywhere we dug test holes, but I was thinking maybe closer to the house it might have been a little bit better because the ground's higher up there, but hard to tell. I didn't really dig a hole there. So, but we're going to try to get as much as we can when all this takes place.
Well, Mr. Chairman, this is Perry Jewell.
Very,
Yeah, I guess through you to Jim at least. I mean, Jim, I guess what are we going to be approving here with regard to this request number 2? Or how would you, is there a way to word that so that this will be useful? Or should we wait until the next meeting, or should we, how would you modify number 2 if given what we know today?
So I guess my recommendation would be to modify it to what we think based on the 18-inch water table, the offset to the water, to the outlets would be, and approve that request so they don't have to come back. And if we can raise it, then it gets better.
Okay. How would we change number 2 then?
Doug, I guess I'd let you do the math and figure out what you might need for.
I think
I would be willing to do this. I would be willing to entertain a motion that we would approve this provisionally. But with the proviso that nothing gets done until we get the results of what you're going to do tomorrow. I don't want to do anything that's going to make this worse with this request. I would need to see a new one, and that's going to put it off for another 2 weeks.
Well, I guess, George, if we were to take the water table as we found today and kind of extrapolate it up to where the tanks are, it's likely the outlets are probably just below the water table, if I had to guess. If we took the worst case scenario and you approve that, and they're able then to lift the outlets, then you've approved the worst case in case it can't be moved, and hopefully it can be moved and the situation be made better. I mean, that would be my suggestion to move it along.
Just to help also, I think, I'll just say that monolithic tanks will go in with the boots, just as an extra safeguard too, to make everyone feel more comfortable.
So we should add that then to, as a requirement.
I'm thinking. Does anybody have any other suggestions? I'm very uncomfortable with this. I don't like to bring before the board to the floor a what if, or maybe if this happens. I'm more comfortable if this was, carved in stone, but it isn't. And this isn't because of our problem, it's because of an issue that apparently got overlooked or got missed somewhere along the line here. I don't want to do a blanket approval here. The best I'll do is I'll do a provisional until we get some more information. If this works, fine, you've got a permit. If it doesn't work, you're going to need a new permit. That's my take. Anybody got anything else that they want to add to that, or?
So,
I'm
Mr.
not sure if
Chairman,
that
this
means
is-
you agree with me or if you don't agree with me.
Mr. Chairman, this is Perry Jewell. Given
Yeah, Perry.
that, I would recommend, I would be willing to move that we approve these requests, or, these variances as requested. And with a proviso that the inspection tomorrow may require them to come back if they can't meet these.
I'll second that.
Motion's made and seconded that we grant the permit as requested, or the approvals as requested, with the proviso that we can not begin construction until further examination of the site is performed. Is that okay, Perry?
Yeah, if they can move move that pipe higher, then they can meet these, so.
And you should know that by tomorrow?
Yes,
Let's do it that way. And then if modifications are made to the plan, we will have to revote this at our next meeting, gentlemen and lady. We need to point that out also. Okay, motion's made, and somebody want to resecond that with the addition?
I'll resecond it.
Okay, thank you.
You're welcome.
Evan. Okay, motion's made and seconded. All in favor, say aye.
You need a roll call, I guess.
Yeah, we need a roll call. Yep, say aye in your name.
Yes, I'll begin. Perry Jewell, aye.
Jordan and aye.
Paul Forten, aye.
Evan Waters, aye.
Lisa, you gonna vote?
We need to unmute.
Okay, so it is unanimous, I
No,
guess?
Lisa's was muted.
Yes, yes,
Yes.
aye. Lisa
All
Norman.
right, motions.
Sorry.
Motion's made, voted, passed, approved. The modifications are, or the requests are approved with the proviso of modifications to be performed or inspection of the site be performed before construction begins. Okay. That's it.
thank you.
That was a tough one. You're welcome. Doug, take care.
Thank you. George, you're muted.
The mouse is weird. Is that better?
Yes, now you're good.
Wow, that's strange. Okay. That's done. The next item is minutes approval for May 3rd. Has everybody gotten a copy of the minutes and read them through?
I have, yes.
I have as well.
Okay, we have majority who've seen them. Apparently, okay. Motion to accept the minutes as written.
This-
We want to do them
I will-
both together.
Okay, motion's made. All in favor, Troy Demon, aye.
Perry Jewel, I.
Paul Forten, aye.
Evan Waters, aye.
Lisa Normandin, aye.
Do we have other ones or?
I missed who was the second on minutes.
Who
You can
seconded
show me,
that?
you can show me as the second,
Okay,
Andrew.
so Waters and Jewel?
Yes.
Okay, thank you.
Do we have another one or? Yes, I have another one here for April 5th. Has everyone seen?
Well, I
the-
think the motion as made, Mr. Chairman, by Evan was to accept both.
To accept the May 3rd?
Yeah.
I thought we
because,
did. Oh, to do both, okay. All in favor? We did that, well, I thought we did this for the rest, okay. Motion's made, seconded, and so voted to accept the minutes as written. Okay, let's see. Where's my agenda? I love these meetings, so quick. Accepting permits, we don't bother with those anymore because we can't see them to sign them. New business, is there any new business? COVID, Jim, would you like to give us a current report on COVID?
Talk about new business. The governor's announcement today, it's open in the state, wide open. So just kind of locally first, the cases in town have been kind of stable the past few weeks, which has been nice, and stable low, which is even better. So the governor's announcement today, kind of touts why they're making the changes. A significant number of people fully vaccinated, even more have at least a first dose. And we have lots and lots of vaccine in places you can get it, with the hope that more and more people do, so it's safer to reopen. The amount of changes is kind of staggering. I don't want to say everything's open by the 29th because there's still nuance to that, but I'll send around the governor's press conference because it does give you the intricacies of the things and how they'll open. The mask mandate for the most part will be dropped by the 29th. There will be places that you will still need to wear masks, healthcare situations, public transportation, schools will follow DESE guidance. And again, there's additional congregate settings. Again, schools will follow their guidance. A lot of the sector-specific workplace standards and the workplace safety standards, one of them are done by the Department of Labor and Standards, the other by the Executive Office for Environmental Affairs. Those will probably reduce pretty significantly down to almost nothing by the 29th. All industries will able to be open, and there'll be no more gathering and capacity limits. Again, the details will trickle out. I know some of the standards have been modified already. The camp guidance has been modified from what it was originally going to be. The camp guidance had some pretty, I don't want to say draconian, but pretty strong requirements for testing early on. If you were sending a kid to overnight camp, they're going to have to be tested 3 days before, tested day of. Now those become just a recommendation or best practices, they describe it. So a lot of things that were once requirements are now best practices. I assume you'll see that with a lot of the other sector-specific workplace safety standards. Another big emphasis or de-emphasis, if you will, is on surfaces and surface cleaning. They're kind of going back to CDC requirements, going back to frequent and ordinary type cleaning, unless there's some kind of visibly soiled area or there's a reason that you need to do some additional cleaning. So I think that's important too. The sports requirements, again, they tried, I think the state has always tried to do kind of a stepwise roll back, either whether they're ramping up or rolling back. And sometimes in these short periods of time, May 10th, we had a whole series of changes that were made to the standards. Then CDC came out with a requirement that nobody probably really went and read. They just said, oh, we don't have to wear masks anymore. That really wasn't the case. So the governor came out today, and so now we have May 10th requirements. We'll have some interim requirements to the 29th. And then even after the 29th, schools, congregate setting, public transportation, there'll still be the mask requirements. So again, whenever you're working with somebody on these requirements, it's important to take a look at the last set of guidances to be able to provide. The sports standards as of tomorrow, most sports for kids under 18, they don't have to wear masks while they're actively playing, which I'm sure the kids will be happy to hear. So again, it's kind of a hodgepodge of things that have changed. And some of it, I think, is to kind of step back in a systematic way. The state of emergency, according to the governor today, will be removed as of June 15th. And again, I would imagine he'll work with all of the towns and requirements to kind of back that off, whatever enacting legislation and executive orders that kind of declared that. So, it's 2 months early than we originally thought it was going to be. Is that a good thing? Well, hopefully it is, and hopefully people continue to go out and get vaccinated. There is plenty of it out there to get vaccinated. And again, I think we were all really looked forward to this kind of happening, and I'm looking forward to the 29th, so we don't have as many interim steps to try to walk people through. Because I think, people hear the headline and don't see all the information behind it. I think it'll be a little bumpy from now until the 29th, because there are still some of those requirements in place. So I don't know if anyone has any questions.
Hey, Jim, I have a question. Paul Forten.
Yep.
Will we be able to get together at the Ritter, the Board of Health, on the 29th?
After the 29th?
Yeah.
On the 29th.
So the state of emergency is
Our
being
next
lifted on,
meeting,
it's being lifted on the 15th.
our
I
next
think-
meeting is June 7th. That will be a Zoom meeting. After that, we'll probably go back to in-face.
And
Thank
that's
you,
why I
Mr.
think that June 15th, the revocation, if you will, I'm not sure what the term is, because I don't think I've ever been in a state of an emergency before. So whatever that term is, to remove all of that. After that, I would imagine, governmental bodies will have new instructions about how to conduct meetings and that. So I would say it's safe to say after the 15th. And I think that from the 29th to the 15th, I think, is to allow, the state government to kind of work with the local governments to figure out how they're going to transition back to that.
Thank you, Jim. And thank you, Mr. Chairman.
You're welcome. Does anybody have anything they'd like to talk about?
I just want to say congratulations to Paul and welcome to Lisa as well. I'm sure I missed that earlier tonight. But congratulations, both of you. It's nice to see it's nice to still see you, and welcome.
Thank you.
Thank you, Evan.
Okay, is that it? Okay, we can entertain a motion to adjourn.
So moved.
We have a motion to adjourn. All in favor, say aye with your name. Georgina? Oh, did somebody second that? I thought Evan just said. Evan, you second it?
No, I
Okay.
moved. I
Sorry.
moved it.
Okay.
I'll
So-
second it, Mr. Chairman, Paul Forten.
Thank you, Paul. Everybody sounds alike with this foolish thing. Okay, motion's made and seconded. All in favor of adjourning, say aye with your name. Georgine, and aye.
Jerry Jewell, aye.
Paul Forten, aye.
Evan Waters, aye.
Lisa Normandin, aye.
Aha, thank you very much all for coming. Lisa, hope you make a lot of meetings. Every once in a while we have late people. Try to be on time, please.
Excuse me?
Get here by 6. That's
Not
even-
you.
Take care, everybody.
Good night.
Good night.